Hi, I'm Meg Disler, Director of the St. Joe Community Health Foundation, and I am delighted to introduce this brief chat on what every pregnant woman should know about how to take care of themselves during this crazy time of the COVID-19 pandemic. Let me introduce my friends, Dr. Lora Overton, an OBGYN board member and advisor to the Prenatal and Infant Care Network, and Jackie Martinez, Program Manager of Healthier Moms and Babies, which assists over 500 pregnant women and their babies annually in Northeast Indiana.
Hi, Dr. Overton, and thank
Hi.
you for joining us today on a very important topic on the impact of COVID-19 amongst our pregnant women and families. So thank you again.
Thank you. It's nice to be here.
Yeah, thank you. I'd like to just take, a few minutes to just kind of pick your brain and provide some answers to some questions that I know many women and families in our community have, and I think it's important for them to know. So at Healthier Moms and Babies, we serve at-risk pregnant women through home visiting. So we educate them on, prenatal education, kit counts, nutrition, importance of prenatal care. And with the current climate of COVID-19, we've now had to add another layer of education. So when I meet now, or our case managers and or nurses meet with our clients, it seems to be that they're not as concerned about COVID-19. Can you tell us why it is important for pregnant women to be careful and protect themselves against COVID-19?
Well, yeah, pregnant women are not immune to COVID-19. They can also catch this very deadly virus. And the nature of pregnancy is that a woman is immune compromised. She has to be immune compromised in order to carry another human being in her body. So she is at risk for COVID-19 just by the nature of being pregnant.
That's very true. And what is the impact on pregnant women if they were to get COVID-19 and their baby?
And their babies. Well, just briefly understanding that a woman who is pregnant has to eat for her baby, she has to breathe for her baby, and just looking at the respiratory symptoms of a woman with COVID-19, if the mom is not getting enough oxygen in her system, she can't give the baby oxygen. And we know that babies that go without oxygen to their systems, their organs are smaller and may shut down, and also their brain development is less. That brain, that small developing brain, needs oxygen in order to function. And so when a mom is not getting what she needs, the baby is not getting what it needs.
Yeah, and how crucial, is the nutrition and the milestones to be met while baby is growing in utero.
Yes.
So do you know, because this has been kind of a long haul and we're in our 6th month of this, I think the fear factor has lessened. But do you know to date how many pregnant women have been infected?
Yes, I do. The CDC updates those every Thursday afternoon. So I have the numbers as of August the 6th of 2020. And those numbers tell us that about 15,700 pregnant women have been affected by COVID-19. Now, also understand that only a fourth of the reports that the CDC get include information about pregnancy. So the CDC thinks that there may be more than this. So of that 15,000, Hispanic or Latinos are impacted about 6,000 cases so far in the United States. And you will think, well, that's not a lot of numbers. That's not a lot of women. But when you consider that Latinos account for only 18% of the population, and yet they account for 40% of the COVID hospitalizations, that's a lot. When you add in the Black population, which is about 13% of the population, there's about 2,700 Blacks, women who are affected by COVID, which is 18% of the hospitalizations. You add those two together along with the Asian, multiracial, Native Americans, you're looking at over 60% of women affected.
Yeah, and from what I'm hearing, Latino and Black women in particular are at the highest risk and the ones that are being affected the most,
Correct.
which
Correct.
already adds to the layer of them being at highest risk for preterm and or infant mortality.
Yes, it does. So it's just one more thing, one more issue, one more problem that Black, Hispanic, Native American, Asians have to deal with in this very stressful time.
And with that being said, with the impact, how how and what would you say to women on how to best protect themselves from being infected or contracting COVID-19 and how to protect their families?
Well, listen to the experts, first of all. Don't get your information from the gossips down the street. The experts are telling you that this is very simple. Wear a mask. Wear a mask. Whenever you're outside of your home, wear a mask. The second thing is social distance. Whenever you're outside of your home, stay 6 feet apart from anybody else. And the third thing is make sure that you wash your hands a lot. I know it seems redundant, but wash your hands for 20 seconds whenever you're out of the house or you're touching something that someone else has touched. It's not hard to do, to wear a mask, social distance, and wash your hands.
And with that being said, I know that also some are on the opposite spectrum where they're even afraid to leave their home. So for pregnant women, do they not go to prenatal appointments?
No, it is absolutely important that you keep your prenatal appointments, every single one. Also understand that doctors in their offices are taking precautions. All of the doctors in their offices are making sure that there's not a waiting room full of people. They're having scheduled appointments and keeping people socially distant. So they're taking precautions, looking out for your health as well. So make sure that you keep all of your prenatal appointments and all of those baby appointments.
Very good. So the very opposite. Attend your prenatal appointments, but just, keep the safety precautions in mind
Exactly.
or practice them.
Yes.
Okay, so with that, we have clients that have called and have said, I think I might have COVID-19 and I'm pregnant. What should I do?
The first thing they should do is call their healthcare provider, whether that be their doctor or their midwife or his nurse, and find out what their provider wants them to do. A lot of providers may not want you to come to the office to get tested. They may want to send you to another facility to get tested. And we will have a list of those testing places on the screen after our discussion.
Very good. Well, thank you so much, Dr. Overton. This is a conversation that has been, I think, really at the forefront of being needed and heard. And I hope that, women in our community have the chance to be able to really maybe have some ease with some of these answers and have access to this video and to some of the words that you have shared today.
Thank you for having me.